Hi, I'm Duquesa Dean, and it's such a privilege to host the Her Fight, Her Story for Doctors Hospital. Today, I'm speaking with Dr. Antonio-Collie. Dr. Antonio-Collie, I'm meeting you for the very first time today in person, and I'm sure that there are other employees or perhaps visitors to the hospital who may be seeing you for the very first time as well. Tell us a little bit about you. Why did you get into medicine, and what do you love about your job?
Well, thank you so much, DeQuesta, for that question. So basically, I wanted to be a doctor since I was a child. And I actually was under the impression that I would be the first Bahamian physician, female physician, but I was wrong, of course. Many great female physicians have gone before me. And so I love medicine because it is a healing art. I'm a scientist at heart, but I love the healing nature of medicine. And so that's what attracted it to me when I was a child. And then, of course, growing up through the sciences just made it a really attractive fit for me. But in general, I love what I do. I love helping to make people feel better, getting them through some pretty rough times. We like to say we manage fear and anticipation, but I like to make sure that we manage it in a way that people are comfortable and guiding them through, like I said, some pretty rough patches.
Yes.
Yeah,
And that's so
definitely.
important to keep the human aspect
Absolutely.
alive as we serve others. So thank you so very much for your dedication to helping others feel better and for serving at this high position that you serve at, which must come with a lot of responsibilities. So thank you for your service.
You are so welcome.
Today we're talking about breast cancer. And as we begin our discussion on breast cancer, can you give us an idea of perhaps why breast cancer may be so prevalent in our community?
Breast cancer is the #1 cancer in women in the Bahamas. We have a high prevalence of breast cancer in this country. We have hundreds of new cases that are diagnosed every year. In 2020, there were at least 166 reported new cases of breast cancer. We know that there is many things that cause women to be more at risk for breast cancer. One of them is genetics, of course. You may have heard about the BRCA gene that a lot of Bahamian women tend to carry. But then there is also lifestyle that can also impact our risk of breast cancer. So in combination with the fact that we are perhaps a little bit more genetically oriented in the Bahamas, because indeed what we know is that 48% of the cases of breast cancer in women in the Bahamas are under the age of 50, which is very different than the statistics worldwide. When I first came back home to practice in the Bahamas, I don't think I had ever seen a patient with breast cancer under 50. And when I got here to the Bahamas, my first patient with breast cancer was age 29.
Wow.
So it is definitely something different about breast cancer in our region that we have to pay attention to.
That's real interesting facts that you shared. Just the fact that genetics plays such a high role in women having breast cancer here in the Bahamas is something that we should pay attention to. Knowing the diseases that are in our family lines is certainly something that's very important. And also recognizing that it is the #1 cause of cancers here in the Bahamas for women should mean that this is on the priority list for every woman.
Absolutely.
And since we know that it is the #1, what would you say are other top cancer diagnoses here in the Bahamas?
So breast cancer is the top diagnosis of cancers in the Bahamas, followed by prostate, then colorectal cancers, cervical cancers, and then cancers of the stomach. So those are the top cancers in our country. And once again, those are the things that we need to pay attention to as we move on in our life, really sticking to our physicians and asking about screening, timing for screening, when is it appropriate to do screening for some of these cancers so that we can mitigate.
Yes. So I don't know if you are aware, but I am president of a cancer support group for women. And a few years ago, I did a survey generally for women in the Bahamas, asking about their reasons for not getting their annual exams. And 75% of women said that they didn't want the diagnosis, and so they didn't attend a physician to get their annual physical. What are some of the symptoms women can look out for if they're not going to get their annuals? What are some of the things that they can look out for to say, hey, this is something that I should pay attention to, particularly since I'm not going to see a doctor?
So that's an excellent survey that you did. Very, very eye-opening. But indeed, still, women should be looking for certain symptoms. So you can start with, obviously, if you do have a new lump in your breast. And I say new lump because I encourage women to do their own breast self-exams. And the other thing that we find common in women, in the Bahamas in particular, is that we have lumpy breasts. And so, finding a new lump in your breast should trigger your need to see a physician to determine whether or not this can be cancer or not. Looking at your nipples, is there a discharge coming from them other than breast milk? Looking at your nipples, are they hardened? Is it flaky? Looking at your breast itself, is it swollen? Does it have a feeling like an orange peel? Hardened and thickened as well too. So those are some of the things. Also checking to see if you have a lump under your arm, because sometimes that could be the first thing that you feel other than a lump in your breast. So those are some of the things. And even breast pain. Breast pain doesn't always indicate breast cancer, but it is something to be concerned about that you should probably seek attention for.
So there would be some symptoms, some sign that,
Absolutely.
hey, I need to see a doctor, and we shouldn't just bury our heads in the sand.
Absolutely.
Just if you feel something abnormal, and what I like about what you're saying is that you have to know what normal is first.
Correct.
So paying attention to what your breasts look like and how it should operate is important, so that when something is outside of what's normal, you know when to see a physician.
Absolutely.
Now, years ago, cancer treatment was harsh. It was very different from what it is today. And with that, perhaps you can share with our listening audience how cancers are treated here in the Bahamas now, so that we can take away the fear of a diagnosis.
So great. So there are different forms of cancer therapy. So first, the one I think people fear the most would be surgery. And that surgery can take the form of an excisional biopsy. So this is where you take out the lump and you send it to be biopsied, and that in and of itself is a treatment because you're removing the cancer. Then there's also the mastectomy. I think that's the one that people don't want to hear about.
Yes.
And that's removal of the breast tissue, breast itself. And so definitely that's more of a major surgery, and a lot of times it comes along with taking out any lymph nodes that may also be prevalent, you may find as a result of your investigations. Then another very common treatment that people may not want to hear about is the chemotherapy. Chemotherapy is given either orally or intravenously. And chemotherapy can take many forms, and it will always depend on what type of breast cancer you may have. And so definitely that your chemotherapy is structured to what type of cancer is determined on your pathology once you have a biopsy done.
Right.
And then you have some newer therapies. Well, there's the radiation therapy, not so new, but once again, it is a therapy that a lot of times goes along with the chemotherapy, and that is where radio frequency is added to the chemotherapy to kill cancer cells. Newer therapies include hormonal therapy. Hormonal therapy can take various forms, once again, that they can be tablets or they can be given intravenously and sometimes by injection as well. One of the newer forms of treatments are the biologics. We call them the biologics. These work with your immune system. And they are once again formulated based on the type of cancer that you have. They also look at your body as a whole. These have gotten a lot of traction. They're the newer forms. They have less side effects than some of the other tablets. And so indeed, these are some of the therapies that are available here in the Bahamas, many of them through Doctors Hospital as well. And they are definitely worth investigating if this is something that's happening to you or your relative.
Right, and so as a physician, as you listed off all of the options for cancer treatments and having the patient make the decisions about which ones would be best for them in conjunction with their doctor's advice, what I'm hearing you say is that there's no one treatment for every single person,
Correct.
but it is individualized depending on your type of cancer, your body makeup. So we're not just generally treating people.
Correct.
Right?
Yes, absolutely.
Okay. So to the lady in your employment, or perhaps someone sitting down watching this video right now, if you could just speak to them and encourage them to stay ahead of the game by getting their annual physicals, like what advice would you give directly to them?
Okay. So, definitely a diagnosis of cancer is a scary one. But I think it's very important for us to be as informed as we can and to stay ahead of what could be out there. And so knowledge is power for sure. So equip yourself with good knowledge. Speak to your physician, speak to other ladies that have gone through these issues in the past and have survived. So one of the things is obviously doing your annual physicals, very important. With your annual physicals comes screening, such as the mammogram or your 3D imaging that would help to detect any type of early stage cancer. So those are some of the things that can mitigate. But on top of that, doing things like keeping active, going ahead and doing some exercise, a healthy diets that are filled with antioxidants that we know are cancer fighting, like dark green leafy vegetables. Also too, being careful in terms of medication and avoiding certain medications if you can, such as if you're over 35, birth control pills over 35, especially if you smoke, is something that's not recommended. Being careful with hormone replacement therapy, really speaking to your doctor and looking at your risk factors. So some of these things that could really help us to stem the tide as we see that the prevalence is not really going anywhere, and we really need to be as safe as we can and be ahead of the game. And this is a fight, definitely, but it's a fight that we can win.
That's some really great advice. I learned a lot from you just now as well. Movement is important,
Yes.
and we should pay particular attention to our diets. Our diets are what fuel our body, and we can either be giving our body good fuel or bad fuel. So the choices that we make will either help to keep disease at bay or will activate it. And that again is an individual decision. So we must make the best decisions for ourselves and own our health. That's what I'm hearing you say, right?
That's absolutely correct.
Okay. So in your position here as Chief Medical Officer, can you just tell me a little bit about what you offer specifically? Because I heard you say Doctors Hospital offer some of those treatments, but very specifically, what can people come here for if they believe that there's a risk? They're not sure yet, but they believe there's a risk. What are some of the services they can come to Doctors Hospital and avail themselves of?
So we've invested a lot in our state-of-the-art equipment in order to facilitate high touch, high tech, which is one of our mottos. And so we like to stay ahead of the game in terms of treatments, in terms of modalities that may be available. So mammography, we have state-of-the-art mammography that is right now top of the line in the Bahamas. We also have the 3D imaging as well too. But we also have medical services for you to come and get your screenings done, your health checks through our primary care clinics, and then if need be, referral to a specialist, one of our OBGYN specialists or our medical oncologist, to make a determination of any type of treatment that you may need moving forward. And then of course we deliver chemotherapy if that is needed as well too. And our pharmacy is equipped with or has the ability to acquire any of the medications that are state of the art right now for treatment of breast cancer.
So it sounds like Doctor's Hospital is like a one-stop place that you can get diagnosed and treatment as well. So you're not running all over the place,
Exactly.
right? And
Absolutely.
that's for convenience.
Absolutely.
Right? And it's really what patients need.
Right.
So there's one location you can get everything
Right.
done at.
Right, we call it integrated care.
Integrated care.
Absolutely.
I like that. I like that. As we look forward, we know that today there have been many advancements in cancer treatment. Doctor's Hospital has made tons of investments in its equipment and its ability to diagnose and treat cancer. What projection do you have for the future to help with perhaps prevention and further treatment? Is there anything on the table to advance what you currently have?
So definitely at Doctor's Hospital, we like to say that we are as innovative as we need to be. And so definitely we continue to explore other avenues through our research and development. And we also engage people who are involved in advanced treatments and look to see how they may fit with our Bahamian population. So things like stem cell, which is something that might be futuristically important for breast cancer. Things like transplants that also may also provide some help as well too for various types of cancer. Okay. So definitely we are staying on the cutting edge of what's available and to bring it to the Bahamian population because we know that we deserve this.
Yes,
your health is worth it.
Yes, it is. Historically, it was recommended that women receive or get mammograms around the age of 40. And given that younger women are now being diagnosed with cancer, what is your recommendation for when screening should start?
All right, so definitely generally, once again, the theme is that you should start screening at least by age 40. Here in the Bahamas, we have been known to screen by age 35. However, if you have a primary relative that has had breast cancer, you should screen 5 years prior to the age they were when they were diagnosed with breast cancer. So once again, here we go with it's not a one size fit all. Yes. So you should really speak to your healthcare professional so that you can talk about your risks, talk about what's going on. Once again, know your family history and know the things that may cause you to be at high risk. If you smoke, if you're a drinker, if you're overweight, things like that, that may end up elevating your risk, and knowing when it is time to begin screening safely.
Yes. So I, in full transparency, will share with you that when I turned 45, I didn't do my screenings for 2 years because it was at the age my mom was diagnosed with breast cancer before she passed away. And subconsciously, I didn't want to get a diagnosis, and so I avoided going to get tested, which is really counterproductive because you should want to know, right? On the human side of things, how can we address that fear for women who may be afraid, and even men, because we know men get breast cancer as well? What would you say to help alleviate that fear for someone that's saying, I don't want to know, I don't want to know, but you know, we really need to know? What would you say to that person?
So, you know, what I will say is that fear is not your future, and that knowledge is the power that you need to face anything. Because once you know, especially if you know early enough to be able to move ahead and to be able to face what it is and be able to have a team around you that will assist you in facing what's moving, what you may need to face ahead. I think that's important as well too. And knowing that you are surrounded by a team of experts that can help if there is a problem, to walk you through the paths that you may go through. And there are other women that have walked this way, and just talking to them and looking at them and seeing how they manage to go through and to survive and to fight. I think that's very important. Just to know that, yes, you may be scared, but sometimes we have to do things scared,
Yes.
but just keep walking through it.
Yes, thank you so much for that, because I think women need to hear that even when we get news about something that we don't want, we can still move ahead of it if we have the right people around us, but fear will work against us,
Yes.
right? And so knowing that and keeping in mind that early detection is the best for your cancer care, can you just tell us what's the difference between getting an early diagnosis and a later stage diagnosis?
So definitely with early detection, many times women have the ability to survive this as long as
Yes.
they can.
Yes.
And many of them will die from something else.
Yes.
So early detection is very important. Of course, late detection means now the fight is on. All right, the fight is on, because many times that means that the cancer may have spread. And unfortunately, here in the Bahamas, 48% of women are found at stage 3, which means that it has spread. And so you definitely enter into a battle that is very tough. But however, with early detection, we detect from stage 0 to stage 1, and the cure rates for that, if I could use that word, very high. And so definitely, it's very important for women to understand the difference and use that knowledge
Yes.
in the place of that fear.
Yes. That gave me so much hope just now, actually, to hear that you could be diagnosed at stage 0, which is a precancerous diagnosis, or at stage 1, and your fight will be less aggressive and vigorous than a later stage.
Correct.
Which again is another incentive to do those checks, those annual checks, so that we stay ahead of the game.
Right.
So as we close our interview today, Dr. Antonio-Collie, I want to just say thank you for the wealth of knowledge that you've shared. All of this information is so super important, and it's relatable and easy to understand. So thank you for breaking it down for us so well. Are there any final remarks that you would like to share with your colleagues or anyone watching this video in the future?
I just want to say once again, know your risks. Go and get your checks. Do your own self-breast exams. Get to know your breasts. Get to know your body. And I think that this is a fight that we all can win.
Thank you again, Dr. Antonio-Collie. It was a pleasure to sit and speak with you and learn from you. And thank you so much for watching this series today. If you have any questions, please reach out to anyone at Doctor's Hospital. They will direct you to the correct people and places so that you can get the diagnosis and support that you need. Take care.
Doctor's Hospital invites you to go pink this fall with the purchase of a mammogram for yourself or a loved one. From October 1st to December 31st, mammograms are only $60 for self-pay patients, and for insured patients, your copay will be waived. Call 302-4662 for more information and register at doctorshosp.com/register-online. Doctor's Hospital, your breast cancer detection one-stop shop.